Are you or is someone around you bleeding profusely right now and you came to YouTube to learn how to put a tourniquet on real quick? Now's not the time to be learning how to put a tourniquet on. So get off the YouTube, call 911, the dispatcher will walk you through it. Alright, are they gone? Are they all gone? Okay, good. Now it's just you and me here talking. Today we're going to be talking about tourniquets. Okay, we're going to do a deep overview. Maybe you've got no experience with tourniquets. Maybe you've had some experience in the past, but it's important to get training and it's important to practice frequently, especially when it comes to medical stuff like tourniquets. And with that said, YouTube videos are great and all, but they're no substitute for actual medical training and actual practice that you do yourself. These videos can be a great aid to help you practice. They can be an aid in your training, but they're no substitute for medical advice, medical training, and the like. So with all that, let's get started. So let's begin at the beginning. What is a tourniquet? A tourniquet is a device that can be made out of elastic, rubber, nylon, cloth that's wrapped around a limb, an arm or a leg, that can be used to help stop life-threatening bleeding. It does so by compressing the limb and cutting off the blood flow to and from that limb. It is really nasty outside today. We got a blizzard coming through here in Northwest Illinois. It's early March. They say beware the Ides of March. So let's continue our tourniquet conversation out of the elements, shall we? So what does a tourniquet do? How does it work? Well, by applying pressure all the way around a limb, like I said, an arm or a leg, it essentially acts like a clamp on those arteries and veins within that limb, cutting off blood flow from the injured area. So the question is, when do you apply a tourniquet? Well, of course, we always apply direct pressure to a wound first. If this doesn't work to stop the bleeding, or if that cloth or old t-shirt or towel or whatever you're using becomes soaked in blood because it's not stopping the bleeding, now's the time to apply a tourniquet. Other situations where a tourniquet might be used are if the person who's bleeding actually lost consciousness from the bleeding, or if we don't know why they lost consciousness but we see bleeding, we're going to assume it's from too much blood loss. Also, if the person has an amputated or mangled limb that has multiple bleeding points, too many to apply direct pressure to try to stop the bleeding. Also, anytime there is a deep wound on an arm or a leg and we see pulsing or spurting blood coming from that wound, get your tourniquet ready, it's time to put it on. So, where can a tourniquet be applied? A tourniquet can be applied to arms or legs. There have been some extreme cases where tourniquets have been applied around people's torsos, but that's pretty heavy-duty stuff there, and we're not going to get into that today. We never put a tourniquet around a neck, a head, places like that, so we're focused on limbs, arms and legs. Now there are many different kinds of tourniquets. Like I said, we're going to be looking at the CAT tourniquet, the combat application tourniquet. There's tourniquets out there with ratchets, like a ratcheting tie-down would have. There's tourniquets out there that you can tighten up with a dial. And chances are, if you've ever had blood work done, like at the doctor's office, where they put that little elastic band around you, that's even technically a tourniquet. So today, we're looking at the combat application tourniquet. So knowing that there's a wide variety of tourniquets available on the market, the question is going to come up, what's the best kind of tourniquet? Well, the best tourniquet is the one you have, and the one you have training on, and the one you have practiced with. Practice, practice, practice. So we've talked about commercially available tourniquets, right? Ones that are manufactured for that specific purpose. But let's talk about improvised tourniquets. Now in 2017, there was a study done on law enforcement using improvised tourniquets. This study was done by Pre-Hospital Disaster Medicine and was a published study. It found that 6 out of 7 times an improvised tourniquet was used by law enforcement, who, mind you, have first aid training and they have training on tourniquets and all that. 6 out of 7 times these improvised tourniquets failed. It's still worth learning how to do an improvised tourniquet using anything from a cotton bandana to a cloth and many different materials. We'll get into that here in a minute. it's still worth learning, because even though it failed 6 out of 7 times, that means it worked 1 out of 7 times. And if that's all you got, hey, I'll take a 1 in 7 chance over a 0% chance any day. Now, it's also worth learning how to do an improvised tourniquet, because even if you have a commercially available tourniquet on you, sometimes you need 2 tourniquets. You need a backup tourniquet and an improvised tourniquet. Hey, if that's all you got, you've only got the 1 commercially available tourniquet and it's not quite doing the trick, you got to apply a second tourniquet. It's time to make an improvised tourniquet. So let's get into the do's and don'ts of improvised tourniquets. Now, before I show you how to improvise a tourniquet, let's talk about material that you should not use as a tourniquet. Specifically rope, paracord, things like that. Now, a good tourniquet should be 1 to 2 inches wide. The wider it is, the more pressure it's going to take to cut off that blood. So paracord, string, things like that are just going to cut into the skin. They're not going to cut off the blood flow. Blood pressure cuffs, you might think that would make a good tourniquet, but that Velcro can come loose, and we definitely don't want it to come loose before we get to the hospital. A belt is just the right width. Usually, it's right in there, 1 to 2 inches wide, but it's almost impossible to get a belt tight enough to work as a tourniquet. So it looks good, it sounds good to use a belt, but to get that thing around tight enough, it isn't going to happen. So belts, paracord, blood pressure cuffs, things like that are out. We're going to simulate that this is a limb with a wound on it and it needs a tourniquet. So here we've got the wound. We'll say the elbow is here, or the knee. We want the tourniquet to be between the wound and the heart. We also want the tourniquet to be 2 to 3 inches away from the wound and 2 to 3 inches away from any elbow, knee, or other joint, ankles, wrist. So 3 fingers away from the elbow and 3 fingers away from the wound if the elbow's not in the way. What I've got here is just a triangular bandage that I've rolled up, tried to make as flat as possible to somewhere between 1 and 2 inches in width. And 3 fingers away from the elbow, we're just going to tie a simple knot. Now we need something to use as a windlass or a twist to tighten up. I'm going to tell my patient, hey man, this is going to hurt, but it's for your own good. So we'll place our windlass, in this case a screwdriver, over our knot. We're going to tie another knot. Now, don't use an ink pen or something that might break, but we're going to want to twist, twist, twist until that bleeding stops. This thing's going to have to be tight. It's going to be uncomfortable, but we've got to get that blood flow to stop completely. So we're going to twist until the blood stops or until we can't twist anymore. Now, to keep this thing tight, we're going to wrap around this end of the windlass, wrap the opposite direction over the other side, and tie that in a knot right underneath the limb. And there we have one form of an improvised tourniquet. Well, you see how even under ideal conditions, when I applied that improvised tourniquet, it was ugly. I don't, if that was a real person, that wouldn't have stayed tight enough to do the job. Thankfully for our patient, Mr. Brick here today, I have a combat application tourniquet, so let's go over how to apply one of those. So like I said earlier, we're never going to apply a tourniquet on the wound. We're always going to be 3 fingers, 2 to 3 inches away from the wound, and 3 fingers, 2 to 3 inches away from any joints, elbows, ankles, wrists, knees, things of that sort. So here you can see I already have the strap going through this buckle. You can keep it stored with a strap not through the buckle yet, or you can store it through there. I think personally it would be easier in the heat of the moment if I had to just pull that out, and do what I got to do, feed this under the leg. But in the heat of the moment, getting that through there might be kind of tricky. So here we've got our loop already set up. You'll notice this little Velcro piece here that says time. I didn't store it like this. I stored it off to the side. That way I'm not fumbling with it and it's not in my way when I need to twist the windlass. So when we apply this tourniquet, we're going to think three things. We've got it in the right place, 3 fingers away from the wound. We're going to think pull. We're going to pull that strap as tight as we can get it. We're going to think twist. We're going to twist this windlass as tight as we can. As tight as we can, or until the blood stops coming out. And we're going to think the word clip. Pull, twist, clip the windlass into the little plastic C-hook there. All right. See how I kept that out of the way? Pull that little Velcro strap and it says time. Write the time down on here. We're going to get into why, but it's very important that down the road people know how long this tourniquet's been on for. And secure that any which way you can. So how do we tell if this thing is working? How do we tell if the tourniquet is working? Well, it's done its job if the bleeding has stopped. And hopefully the bleeding has stopped because we applied a tourniquet, not because of other reasons like cardiac arrest or death. You'll not be able to detect a pulse down here, right? If the tourniquet's working properly, there should be no pulse downstream from where the tourniquet's applied. However, your ability to detect a pulse in an emergency situation may be compromised for a number of factors. Maybe, you're nervous, the heat of the moment type thing. So don't depend on your ability to detect a pulse to determine whether or not a tourniquet is working. If you've got this thing on as tight as you can, it's properly placed, everything's good, but we have not been able to stop the bleeding, it's time to start thinking about applying a second tourniquet. We would apply a second tourniquet in between the first tourniquet and the heart. So maybe like right here, 3 fingers away, you could put a second, maybe even a third tourniquet. Do whatever it takes to get the bleeding to stop. There are some potential hazards from prolonged tourniquet use. Nerve damage. This can cause nerve damage to the limb that it's applied to. It can also potentially cause blood clots to form. So if you have a tourniquet applied to you, or if you apply a tourniquet to someone, make sure you follow up and keep an eye out for nerve damage and blood clots. Now, whether you've applied this tourniquet to yourself or to someone else, your patient, your goal now is to get to professional medical help, right? The emergency room, the hospital. Don't leave your patient, and whatever you do, don't loosen the tourniquet. The patient may try to loosen the tourniquet themselves, so you're going to have to watch out for that. Or there may be other complications that come about depending on what situation you found yourself in. But stay with the patient. If you're not able to, you got to get up and move, you got to go take care of another patient. That's why we mark the time on here, right? What if something happens to us? How's the doctor going to know how long this tourniquet's been applied? In the military, they always taught us to put a T on their forehead using blood, mud, ink, grease, anything we could. Put a T on their forehead so that if we had to leave them or something happened to us, somebody who came upon them would know that this person somewhere on their body has a tourniquet on them. So don't let them, and don't you, loosen this tourniquet up. Do not loosen the tourniquet under any circumstances. The only person that should be taking off or loosening this tourniquet is a doctor or a surgeon. The purpose of writing the time on the tourniquet is so the doctor or the surgeon can know how long this tourniquet's been on, and that will determine their course of action that they take. Because you've placed the tourniquet on your patient or yourself, does that mean you're going to lose this limb? No. If you can get to a hospital within 2 or fewer hours, you should have no ill effects other than the injury itself that caused the tourniquet to be put on in the first place. It typically takes 4 to 6 hours for there to be any ill effects from having a tourniquet applied. And some studies suggest that applying ice or just exposing the wound to cold temperatures outside might even prolong that time. So your goal is to get to the hospital in less than 2 hours. 4 to 6 is really pushing it. Anything after that, there may be long-term effects from having this tourniquet put on. So what are the top tourniquet mistakes? The top mistakes are putting it in the wrong place, either too close to the wound or too close to a joint. Putting it on under the wrong circumstances, maybe applying a tourniquet when one is not called for. Another mistake is not applying the tourniquet tight enough. Like, I can't stress enough that this is going to be tight. This is going to cause the patient, if they're conscious, a lot of pain and discomfort. And they can complain and they can cry and they can beg and they can plead. Another mistake is loosening the tourniquet. Don't loosen the tourniquet once it's been applied. I wouldn't really call it a mistake, but another thing that could happen when you're applying this type of tourniquet is breaking the windlass. You know, you're focused on getting it as tight as you can, and you break the dang thing. Especially with those improvised tourniquets, if you use a stick or an ink pen or something like that, it might break before you get it tight enough. So breaking the windlass, not really a mistake, but it's something that could happen that you're going to have to deal with. Final thoughts. There are a lot of commercially available tourniquets available. I like this one. It's got the little scissors. There's a place to put a Sharpie in there for writing the time down. You could attach this right to the outside of your pack where it's easily accessible when you need it. If you're going to put a tourniquet in your first aid kit, put it at the very top of the kit. That way when you break open the first aid kit, it's the first thing that you can grab. You don't want to be pawing through your first aid kit like a starving raccoon going through some garbage looking for a tourniquet while you or your patient is bleeding to death. So keep this on top of the first aid kit. Keep this on your belt, on the outside of your pack, or if you're going to put it in your pack, put it up at the very tippy top. That way you know where to grab it, you know where it's going to be at. If it's dark outside or snowy, you're not searching for this when you need it. You're going to want a commercially available tourniquet. Don't fool yourself into thinking, well, I could just make a tourniquet out of something I find or something I have on hand. Improvised tourniquets, while they can be complementary to commercially available tourniquets, they are no substitute for a commercially available professional grade tourniquet. And like I said, the best kind of tourniquet that you can get is the one that you get trained on, the one that you practice with, and the one that you have available when the time arises. Okay, there are different types of tourniquets other than this out there. But whatever kind you decide to get, make sure you get properly trained on it, make sure that you practice, and make sure you have it with you when you need it. If you've gotten any kind of knowledge, insight, or enjoyment out of this video, please give it a thumbs up. If you haven't already, hit the subscribe button. And feel free to leave a comment down below. I would love to hear from you. I'll see you all down the trail somewhere. Until then, have a great day.